Namaskar dosto, good afternoon. I'm Anil Mehta, Ayurvedic practitioner living and working here in Holland since last 40 years. Today I'm going to tell you something about diabetic mellitus, a disease but we also know by the name of sugar. It's believed to be a disease of the richest people, those who are not doing much physically and having a rich diet. And it's believed that with sugar you can get 100 years of your age, but the complication make your life worse. So a lot of complications that can be have with this disease. So we have to treat this carefully. And diabetes is of two types: diabetes type 1, diabetes type 2. Diabetes type 1 is a disease of youth. Only young people they get from the very beginning till age of 30-35 years. 10% of all population of the world having diabetes, they are suffering from diabetes type 1. And this is clear that they are having lack of insulin production. There is not much insulin. If insulin is not being produced, then glucose can't get entry into the cell, and then body breaks its own muscle tissue and fat tissues, and one reduces very much in weight. It's very critical situation, and one has to follow strict instructions given by his doctor. He has to take insulin, he has to take good diet, he has to pay attention to this. This is very important. So now come type 2 diabetes. Type 2 diabetes, major difference is that here production of insulin is quite enough. That's not a problem. Problem is that body doesn't react to that. We have got every cell who consumes sugar, they have got insulin receptor, and that insulin receptor, by one or other way, they don't get stimulated, they don't get activated with the insulin produced. So if the cell is not getting activated, then sugar won't get enter into the cell, and that way all the glucose will be in our blood. And all the glucose what's in the blood, that is we call hyperglycosuria. Hyperglycosuria, then it means that our kidney can't absorb that, they have to pass it through our urine. So patient gets a lot of urine, they pass sugar, glucose through the urine, and is frequent urination. Person can have much more thirst, he will feel very weak, and because it's obvious then his body cell is not getting glucose and sugar and he can't function optimal. So why it comes type 2 diabetes? With the age we can get, it can be a lot of reasons. We call that secondary diabetes. Secondary diabetes is that because of one or other problem one gets, like if you are having autoimmune diseases, if there is infection in the pancreas, if there is a hormone problems, and if one way or other for any other disease one is having cortisone, prednisolone type of medicines, that also damages your pancreas. So it can lead to tissue resistance, so that cells, insulin receptor, they don't get stimulated or activated with the insulin. And just to know that every cell leads its own life, and the cell needs glucose to function, and they have got receptor, insulin receptor, and insulin receptor, with the insulin they get activated and cell get open and sugar gets into it. That's the way it will function. So if there is enough insulin, and but these tissues of the cell that get damages, and it doesn't open with the insulin. Insulin is sort of key. So then all the sugar will not go into the cell and will be in the blood available. And now this blood sugar is constantly raised. And this blood sugar is very bad for our blood vessels. It's just a simple test what I tell my people. If you take sugar water, and just put it on your skin, you will see what happens after after 10-15 minutes. You will get irritation, you will get swelling over there. So if blood sugar is much more for a longer period, so it's going to give internal swelling and infection, swelling type of reaction will be. So if it's in the macro blood vessels, so we can get disease like that. If it's in the micro, like our heart, our brain vessels, so one can get stroke, one can get heart disease, a lot of complications. Gangrene with the macro, we can get gangrene, type of wound healing will be delayed. So it's a very simple equation that all the food whatsoever you have taken, it's not actually reaching the cell. That's why it's just outside the cell in the blood, and in the blood it travels with the blood vessels, and blood vessels having constant much more sugar, it's going to give sort of infection, and infection can lead to narrowing of the blood vessels, and that way one can get heart disease, brain, stroke, a lot of diseases you can see. So now what very important is that how this has happened. So we can see the ultimately what has happened is all beta cell of our pancreas, they have been damaged, or there are tissue resistance that with insulin, our insulin receptors, those tissues are damaged, that they are not reacting to insulin. So then treatment should be only for these two categories. We should, on the very first place, stimulate that beta cells that produces insulin. So treatment should be made available for that. And second, that this cells, receptor, they are not reacting to insulin because the cell receptor tissues, they are damaged. So one or other condition, we must think that what we can do with principle of Ayurveda. In Ayurveda, of course, everybody knows lifestyle and things like that, what we have to do. But if we are talking about the destruction type of pathology, what I say that beta cells, they are destructive. They are not producing enough insulin. Then we have got very good herbs in Ayurveda. We call that mamejva. Mamejva is one of the herbs what is working on the beta cells, but is not that good enough to produce insulin. So mamejva helps to rejuvenate those cells. Then you have got a herb called Lata Karanj. That's also very good for that. And the one very famous is that is Mesha Shringi. These type of herbs that works on rejuvenation of the beta cells. And now if we see that in totality also we have to see, not that destruction is of the beta cells only, that destruction in the body cells in totality also. Then also few herbs should be given in combination to that to stimulate in general body cells destruction. That's like ashwagandha and goduchi. These are herbs but we should be giving regularly. And one more concept is of when there is destruction in the body cells somewhere, then antioxidants play a very important role. Antioxidant like shilajit, mukta prishti, and there are much more herbs what works on that. Mukta prishti, amlaki. So these are good herbs what works on antioxidant action they have. So one has to take care of the cells, why they are getting defected and destruction is there and they are not producing beta cell. So this type of measure we have to take. And then there is a second very, very important, what I told you, that insulin receptor, they are not working. If insulin receptor, they are not working, then we see that there is one major role. That major cause is that our adipose tissues, that is our fat cells, they produce a typical type of product that's called adipose cytokines, and that makes tissue insensitive to insulin. So that way we have to work on our adipose tissues. That means that one has to reduce weight. We see that this happens only in people. This happens only in people those who are heavy in weight, obesity. So reducing weight here plays a very, very important role. And reducing weight, therefore we have to give again not that rich diet what I mentioned earlier, and one has to give a few herbs that works on your adipose tissue, on your fat issues, like guggul and kutki and lifestyle, of course. So these are very, very important things. And you can also see that chitrak, black pepper, red pepper, all that type of food herbs what we are using, this works on fat reducing, so that our weight should be reduced, adipose tissues, fat tissues. So in general, this disease of obesity is related to that. So one should give the attention to that. So now, and there is other reason also what can say that insulin was not that effective. Insulin was not in quality wise that good. That was not good enough to open that, how you say, insulin receptor. So that way, always, whenever we treat patient of sugar, of diabetes, we give something what is stimulating, liver stimulating, your thyroid stimulating, because pancreas is one of the major organ what works in metabolism together with liver, with gallbladder, with your other digestive organs. So we give them always something liver corrective, so that if one organ is not functioning optimal, then liver should take the function of that. So if third position I was telling, if your insulin is not that of good quality, if it's not good enough, strong enough to make insulin receptor work, then we have to give herbs like kutki, and you have got few more pipli, haridra, kurkuma, and these type of things work on that. So it's a combine therapy, that we have to work on insulin beta cells, we have to work on, I would say, on the insulin receptors, then we have to work on quality-wise production of insulin. So these are, that's why in Ayurveda, you just can't expect that by giving our medicine, it will work like that. So in a way, it on the long run, it's going to give you very, very good effect. So these are a few tips, but I will give second and more important is that lifestyle. I have mentioned a few times that disease of the riches. So what we have to do now, we have to opt for different type of food. We have to take in place of wheat, rice, we should go for buckwheat, we should go for amaranth, we should go for not really processed food. Food should be with fibers, it should not be processed. And we have to maintain our body temperature. We have to take, how you say, hot water, because temperature is very, very important. Hot water consumption is very, very important. So this way, and not to forget, very, very important is that in beginning I have also told you that when we are not doing much physical job, so we have to walk. We say we have got legs for nothing. Legs are to walk. We have got two legs. It's not for nothing you have got that. So you have to walk. So give attention to yourself. These are things, but this Ayurvedic approach, patient has to do himself a lot of things. But our management should be that way, that we take all the aspects in consideration: food, lifestyle, damaging resistance of the cells. And that was it for today. All the very best. If there are any queries, just call me, just give me a call. I will try to explain that. Thank you very much.